per hour. Okay, and store in the gallbladder where when digestion is not taking place. It transmit it to the second part of the duodenum. So these are the what are the parts of the biliary apparatus? This will be asked in MCQ Viva. Okay, so they are right and left hepatic duct. Look at here, common hepatic duct and the cystic duct and the gallbladder bile duct. Sorry. So these are the parts of the biliary apparatus. Okay, so talking about the hepatic ducts, there are right and left hepatic ducts. It's coming from the physiological right and left lobe of the livers, and it emerges to the porta hepatis, and it's arranged from before backwards. There are right and left hepatic ducts, right and left branch of hepatic artery, and right and left of portal vein. Okay. So we are talking about the common hepatic ducts. So this is formed by the union of right and left hepatic ducts at the end of porta hepatis. It is 3 centimeter long, and it's descend within the right free margin of the lesser omentum. And at the right side, it's joined with the cystic duct to form the bile duct, which will open in the second part of the duodenum. So there are accessory hepatic ducts. It is present in 15% of the subject, and it sometimes come from the right lobes, and it terminates into the gallbladder or in the cystic duct or in the common hepatic duct or sometimes in the part of the bile duct. So this is the accessory hepatic ducts. Now we are talking about the gallbladder. So it is pear shaped, lies in the fossa on the surface of the liver. It stores the bile and it concentrates the bile by 10 times. Okay, by absorbing the water. So measurement is 7 to 10 centimeter, 3 centimeter breadth, and 30 to 50 ml in capacity. So it has different parts like fundus, body, and neck. So, relation of the gallbladder, anteriorly it presents anti-abdominal wall and anteriorly inferior surface of the liver. Posteriorly, you are getting the transverse colon and the first and second part of the duodenum. So, talking about the fundus, this is round and expanded free end of the gallbladder. It projects beyond the inferior margin or inferior border of the liver, where it comes in contact with the anterior wall, abdominal wall at the level of tip of the nine costal cartilage. I told you this is again the surface marking questions. So it is surrounded by this extended part or fundus is surrounded by peritoneum on all sides. Okay. So we'll talk about the body. It extends from fundus to the neck. So it lies in the fossa for the gallbladder. It is directed upward to the left. And upper surface is non-peritoneal, whereas lower surface and the side it is covered with peritoneum and related with the transverse colon and second and first part of the duodenum. So you have to remember first and second part of the duodenum and transverse colon will come to the relation. Now talking about the neck. So neck, it extends from the body to the cystic duct. So and it first curve upward, forward, and turn downward. It's assumed like the shape of S. So it is upward, forward, and it's go like this, downward, downward. So it assume like the say S shape, and it become continue with the cystic duct. At the junction of the neck and cystic duct, there is marked constriction. Between the cystic duct and neck, there is marked constriction. So in the constriction, that is called isthmus, or you'll get in the neck, there is one pouch that is called Hatzman pouch. This Hatzman pouch is present in 75% of the people of the population. Not in everyone this is present. Okay, this Hatzman pouch is, look at it, this is a small diverticulum. It is known as the Hatzman pouch, and it's project downward backward from the posterior medial wall of the neck. This is again MCQ question. from the anteromedial wall, from the posterior wall of the neck, which structure is coming, then you have to say husband pouch, it is coming from the posterior medial wall of the neck. This is also the viva question and MCQ question. So this portion of the neck or Hatzman pouch is sometimes known as, yeah, it's Sudisa, yeah, and Sudisa. So it is also known as, sometimes this is known as the isthmus of the gallbladder. And gallstone is most vulnerable to accumulate over here. So if gallstone is accumulate here, then mucosal of the gallbladder may occur, that is excessive accumulation of the mucus due to the impact of stone on the neck of the gallbladder. So you have to remember this topic, because after doing internship also you can do this in surgery, or you can do easily this cholecystectomy. Okay, whoever want to be surgeon, this is the easy one, cholecystectomy. So please memorize this, all the structures. So cystic duct, look at here. This is 3 to 4 centimeter in long length, and it begins from the neck of the gallbladder. It passes downward, backward to the left, and it's end by joining the right side by the common hepatic at acute angles. So cystic duct join with the common hepatic to form the bile duct. So, what are the mucous membrane of the cystic duct? It is rests about 5 to 12 spiral fold known as spiral valve of the extar. So, look at here, you can see the fold in the cystic duct. This is the spiral valve of extar. What is the function of this spiral valve? Is to keep the lumen open. Okay, so that if the lumen is open, to transmit the bile. So, this valve is very important. Now, another very important is callus triangle. Write short notes on callus triangle. 3 marks question. They asks. You have to draw figure also. You have to write the boundary. This will be asked in MCQ, high bus for short question and spotters also. So look at the boundary. This is the callus triangle. So above and laterally by inferior surface of the liver, below and laterally by cystic duct. Please don't forget to mention above and below. Both are laterally. You can't say simply laterally. You have to say anterolaterally by inferior surface of the liver, below and laterally by cystic duct, and medially by common hepatic duct. So this is the boundary of callus triangle. Please write it down. If you have pencil or copy, whatever, pen, you write it down. Just above and laterally by inferior surface of liver, below and laterally by cystic duct. Look at it, this is cystic duct. Here also you can see inferior surface of liver, this is cystic duct, and medially by the common hepatic duct. So what is the content of the callus triangle? Then look at here, this is the cystic artery. So content of this is cystic artery. So why this triangle is important? Because surgeon utilize this triangle, they will identify, divide, and ligate the cystic artery and cystic duct during cholecystectomy. That means removal of gallbladder. So what they have to do, they will ligate this and ligate this, so that to prevent the bleeding, and to so that this will part will be cut and this will be ligated. Okay, so this is important during cholecystectomy, that is removal of the gallbladder. Are you clear, student? Please remember this and write it down. Hello, class.
Yes, ma'am.
Yes, ma'am.
So this is the boundary and this is the content. So this will be commonly asked questions. If you go through the Q question, you can see this callus triangle or triangle of cystic artery. Now we're talking about the bile duct. So look at here, this is the bile duct. It is 7 centimeter and 6 millimeter in calibre. It is formed by union of common hepatic and cystic duct close to the protohepatis. So it runs downward, backward, falls within the free margin of lesser omentum, that is about the first part of the duodenum. So look at here, this C-shaped structure, this is first part of the duodenum, this is second part, and this is third part. So Supraduodenal part, that means this bile duct supraduodenal part, this is above the first part of the duodenum. So this is supraduodenal part of the bile duct. Thus behind the first part of the duodenum, so this is retroduodenal part of the bile duct. And lastly, behind the head of the pancreas, this is infraduodenal part. So this will appears in the second part of the duodenum. So these are the parts of the bile duct. This is also asked in the Viva and MCQ, that is supraduodenal part, this is retroduodenal part, and the infraduodenal part of the bile duct. As this is 7 centimeter in length. So it's a three part. Near the middle and left side of the second part, this left side of the second part of the duodenum, this bile duct will come in contact with main pancreatic duct. Please look at this picture. Bile duct and main pancreatic duct will come in the second part of the duodenum. Both of this duct will pierce the duodenum separately. They are not combined. They are first piercing the duodenum separately. Okay, intraduodenal part, and within the wall of the duodenum they will form the hepatopancreatic ampulla or ampulla of Barrett. So this is also MCQ or Viva question. It will pierce the duodenum separately, or it combine first to pierce the duodenum. Then what you have to say is the bile duct and main pancreatic duct will pierce the second part of the duodenum separately. But after entering the second part of the duodenum, only they'll join and forms the hepatopancreatic ampulla or ampulla of Barrett's, which is open in the second part of the duodenum. Are you clear? You're getting me or not?
Yes, ma'am.
Now, there are three speeches related to the by this bile and the pancreatic duct. So this is sphincter choledicus. Look at it. This is sphincter choledicus. This is ring of small muscles around the terminal part of the bile duct before its union with the pancreatic duct. So these are the three sphincters. This keeps the lower end of the bile duct close, thereby helping to accumulate the bile in the gallbladder. So this is the sphincter choledicus, and thus essential for filling up the gallbladder. This sphincter choledicus helps in filling up the gallbladder. Another is sphincter pancreaticus. Okay, this is less developed. It's present above the terminal part of the pancreatic duct. Okay, and another last one is this sphincter ampullae or sphincter OD popper, or so this is present at the hepatopancreatic ampulla. So it surrounds the hepatopancreatic ampulla, and it is strongest among all. In some books they are written like it is strongest among all, but in few books it is not also written properly. So if you have you find out what's about this. Okay, it is not asked, but it's written in some book that this one is the strongest one. Okay, so these are the three sphincter choledicus, sphincter pancreaticus, and this one is sphincter ampullae or sphincter of OD. You have to remember this also, sphincter of OD. Okay. Now talking about the blood supply. So look at your blood supply, cystic artery. This cystic artery is the main source, chief source of blood supply. So while doing cholecystectomy, what you will like it, this will cut uh, this, okay, like it this. So this is the chief source of blood supply. It is usually derived from right branch of the hepatic artery. So its branch come from the right branch of the hepatic artery. It occasionally derived from hepatic proper of and gastroduodenal artery. Okay, it sometimes appear from gastroduodenum and hepatic proper artery, and it divides into superficial and deep branch. Look at it; it's divided into superficial and deep branch close to the neck of the gallbladder. So close to the neck, it will divide into superficial and deep. So it distributes the gallbladder, cystic duct, hepatic duct, and upper part of the bile system. Yes. Right hepatic artery give tweak to the middle part of the bile duct and posterior superior pancreatic or duodenal artery. So look at it. This is posterior superior pancreatic duodenal artery will supply the lower part of the bile duct. So chief artery is the cystic artery. At the neck, it divides into superficial and deep, and it may sometimes come from gastroduodenal artery and common hepatic artery proper. So right hepatic will give tweak to the middle part of the bile duct, whereas posterior superior part it is supplied by the what posterior superior pancreatic duodenal artery. This is also asked in the viva. With the lower part of the bile duct is supplied by which artery? Then you have to say posterior superior pancreatic duodenal artery. So look at it, it is supplying the lower part of the bile duct. Are you clear, student?
Yes, ma'am. Yes, ma'am.
Yes, ma'am.
Now, what about boys? Okay, boys, neither like yeah. You are not responding. So venous drainage. So multiple vein. Look at here from gallbladder. Multiple veins are coming, small veins. So those arising from the upper surface of the gallbladders and enters into the liver through the fossa of gallbladder and drains into the intrahepatic part of the portal vein. So a small vein coming from the upper surface, they will goes directly to the liver and to the intrahepatic part of the portal vein. Look at it. Sometimes they are going directly to liver and intrahepatic part of the portal vein. So the remainder of the form one or from two cystic veins which enters into liver either directly or joining. Sometimes they will join and they will directly into the liver. After joining the vein, draining into the hepatic duct and upper part of the bile duct. Really, the cystic vein open into the right branch of the portal vein. Okay, this is the real case. Cystic vein open into the small branch of the portal vein. Mainly, small vein will come from the surface and it will drain. Okay. Now, talking about the lymphatic drainage. So it will drain into the hepatic nodes lying along the hepatic artery. From the gallbladder, cystic duct, hepatic duct, upper part of the bile duct, it's drained into the cystic nodes. Okay, and where the cystic node is lying, it's lying above the cystic duct in the Callus triangle, which we have studied. Okay, so this in the Callus triangle, you can get the cystic lymph node also. So nodes lying in the anterior border of the free edge of the lesser omentum, member of the upper hepatic nodes, and from the lower part into the common bile ducts that drain into the inferior hepatic and pancreatico-splenic nodes. So these are the inferior hepatic and pancreatico-splenic nodes, and through this they will drain into the celiac nodes. Okay. So cystic nodes, you have to remember cystic nodes, which is near the Gallop triangle, and you have to remember pancreatico-splenic nodes, and they all will go to the celiac nodes. Now talking about the nerve supplies through hepatic plexus, it receives the fibers from celiac plexus, right and left vagus, right and left right phrenic nerve. So it gives sympathetic from T7 to T9, which is vasomotor and motor to the springes, that springes, and parasympathetic to the, it is supplied by vagus, that is more motor to the musculature of gallbladder, bile duct, and inhibitory to the sphincter. So sympathetic is motor and it is parasympathetic inhibitory to the sphincter. Now, clinical anatomy, this is very important. Cholecystitis, that is inflammation of the gallbladder. Often associated cholelithiasis, that is formation of stone in the gallbladder, cystic duct, bile duct, due to the alcohol abuse and tumor on the gallbladder. So surgical removal of gallbladder is called cholecystectomy. Okay. So when the finger is placed just below the costal margin at the tip of the nine costal cartilages in the mid-clavicular line, patient will feel sharp pain on inspiration. That is called presence of sharp pain is referred as the Murphy's sign. Why I told you on the tip of the nine costal space. Okay, At the mid-clavicular line, fundus of the gallbladder is palpated. So Murphy's sign is positive in case of this, okay, inflammation of gallbladder. So Murphy's sign is positive when the tip of the nine costal cartilage is palpated. When gallbladder tries to pass through the bile duct, it causes intense spasmodic pain that is called biliary colic in the epigastrium. So when gallstone will passes, so you have to tell the right side. Please remember, liver is present in the right side, gallbladder in the right side. So you have to say tip of the nine costal cartilage in the right side. Okay. In surface marking, don't do the silly mistakes. You'll palpate this Murphy sign in the left side. Maybe due to the nervousness or what. Polylithiasis. So look at here. This is gallstone in, and it's as I told you, it's main common in Hartmann pause, and risk factor is fat, 40 above, fertile, and female. Okay, so this is very risk factors for this 5-4. Fear, here I forget to add fear, fatty, 40, fertile female. Okay, so this is very common in this 5 case. And where it is referred to the epigastrium, and it's over the inferior angle of the scapula through the sympathetic and gastrosplanchnic nerve, and it's refer pain to the phrenic to the right shoulder, and pain in feel in the right hypochondrium may radiate to the right scapular region due to the T7, T8, T9 dermatomes. And tumors in the pancreas also called obstructive jaundice. Another thing also, or that is gallstone ileus, that is large gallstone. Okay, large gallstone entering into the small intestine. Okay, as these are closed, so in this way it will trap in the ileocecal valve, producing the bowel obstructions. If the gallstone is large, it will enter in the small intestine and become trapped in the ileocecal valve, producing the bowel obstruction. That is called gallstone ileus. And cholesynthetic fistula. Look at here. This is fistula also permit the gas from alimentary tract to enter into the gallbladder. And this is the provisional diagnostic radiographic sign. You can see the here over here in the gallstone. Okay, and because of their close, this is because of the close proximity. Look at it. This is closely adherent. So superior part of the duodenum and transverse colon may develop this fistula. Okay. So this is all about the applied aspect. Any question, student? Hello, hello, class.
No, ma'am.
So you go all through this, and this may come. Can I stop the class or what? You need revision. You need to ask question.